it's Sarah here from BJC Health, and we're looking forward to bringing another educational event to all of you. So this upcoming topic is one I'm really passionate about, which I guess sounds obvious considering I help present the event that you're about to watch, but it's all about pain. So whether you have a chronic condition or perhaps you're recovering from your first injury, we now know it's so important for all of us to have a really good understanding as to how pain works. And then what are some things you can actually do about it to help yourself heal and recover and get back to doing the things that you love. So I'm joined in the session by Rheumatologist Fabio. Hope you enjoyed the event. You've got part 1. If you'd like to watch part 2, then please consider signing up for BJC Connect, where you can access all of our educational events for free at any stage. But enjoy the event.
Good evening, everyone. Nice to see you here again on a Wednesday evening. Tonight's a bit of a special night. We've got a new speaker tonight speaking about pain and pain management. Unfortunately, pain still is probably the primary symptom that we see a lot of our patients for here at BJC. So it's nice again to introduce our 2 main speakers. We've got Sarah Comensoli. Hopefully many of you already know Sarah, but for those of you who don't, Sarah's a director of BJC. She's also a very experienced exercise physiologist. She'll be joined by a new speaker in Fabio Kullock, who's actually a Brazilian rheumatologist. We're so lucky to have Fabio with us here at BJC. He's trained as a rheumatologist already, but he's just going through some further Australian accreditation over the next few months, and hopefully by April he'll be fully fledged here in our beautiful city of Sydney. And together with Sarah, they'll be presenting on pain tonight. I'm also joined by Paul Scalise, an experienced exercise physiologist here at BJC, and he'll be helping me with questions and the like tonight. So without further ado, I pass on to Sarah. Thanks, Sarah.
No worries. Thanks, Errol. And evening, everyone. Nice to see you all. Equal parts excited about tonight and nervous. And I guess everyone gets a bit nervous when you have to talk, but I'm excited because I think it's the first time we've put a session on like this just about pain. And although that might be well, that's not so exciting. It's a tricky topic, and it is to talk about, but I think it's really nice to do it in this forum where you're with other people who might have shared similar experiences. We hope you find the environment tonight safe to ask questions. And really, as a health practitioner, I think helping people understand pain is one of the best and most important things I can do, because it really can make such a difference in terms of how you feel, how much you can do, and your recovery in the long term. So that's the exciting part. Why am I nervous? I'm nervous because it's also quite tricky to talk about. And pain, although it's fascinating and it's juicy, and we're going to try and make it as fun as we can tonight, it's also incredibly complex. And because we all experience it in our own way and it's very personal, it can still be quite a challenging topic to talk about. So that's why I'm a bit nervous. So I hope that's okay. So for tonight, what have we got in store? We want to make tonight, again, different perhaps to some of your experiences in a consult room. So I think all of us, my colleagues would share this feeling in that it can be really hard to talk about pain in a consult. For me as an EP, I'm trying to check exercises. I might want to talk about sleep and stress. And so it can be difficult. And especially for Fabio, who has even less time typically than I do to have a consult, can be quite challenging to get through these concepts with the justice and the depth that they deserve. So we're going to try and tackle 9 concepts. And it's quite a lot. And like all our sessions, we'll definitely invite questions, stories, anything you feel willing to share, please do so in the chat, and Errol and Paul will help us get to those. I guess one thing I wanted to mention before we start, though, was it's going to be really hard for me and Fabio to answer anything that's really personal and specific to your situation. So although we love questions, if you can keep it from being too personal and too specific, that will help us get through tonight and hopefully still help everyone learn that little bit more. So while I pull up the slides, though, I thought I'd start with a little poll, and it's a really easy peasy one. So I'm going to launch that now. And I just thought for me and Fabio, but also for everyone, I just would like you to answer how you would currently rate your current level of pain knowledge. So do you feel you know very little? Do you know a bit? Or do you know a lot? And I'll give you a few seconds and then we'll see where everyone goes. A few more seconds, everyone's answering. I think that's about it. 3, 2, 1, we will end. Okay, and I'll share the results with you. So Fabio, are you surprised by these results?
I actually wasn't expecting the 14% on I know a lot, because I marked I know a bit. I don't think anyone knows a lot about that.
Well, that's okay. It's good that there's those people. We can get them to answer the hard questions, Fabio. So no, that's great. So if you do feel you know a lot, fantastic. We will ask you to help us if there's any particular curly questions. Those of you who wrote, I know very little, again, you're welcome. Good on you for being here tonight. I hope we can share some things that help you feel you can learn a little bit more. And those of you that know a bit, yeah, I think that would probably be most people, I think, where, yeah, we've all experienced pain. There wouldn't be anyone here on this call who hasn't experienced pain at all. But when it gets complex and when even things happening in your own body aren't so easy to figure out, that might also impact your confidence and, your own perception of your own knowledge. So thanks for sharing. Again, I hope with our slides we can, help everyone broaden their understanding a little bit tonight. So I'll start sharing my screen. Okay. You guys can see that okay. I'll just start the slideshow. Okay, cool. And I thought, just to reiterate why we're here, I thought I came across this quote when I was reading up a little bit about for tonight. And again, it's a good reminder that the knowledge that you can gain from pain education, so hopefully tonight, or books you read, articles you read, conversations you have, enables you to change the way you think about pain, allowing you to hopefully introduce new coping methods, which might effectively change your experience of pain. So this quote, I think, just highlights how important the knowledge piece is. And if you can understand pain, that really can be such an important step to then help you make changes, make a plan, have other conversations, get more knowledge to then help you move forward. So this is concept number 1. So again, it's all about learning. So I'm going to number the concepts now so we stay on time and stay on track. But the first concept is just reiterating that learning about pain in itself is treatment. And so that might come as a bit of a surprise, or it might be like, oh, but it's different to taking medication and it's different to exercise, and you're correct. But we now have enough evidence that we're really confident to say that learning about pain is a therapy and a treatment in and of itself. So by showing up tonight, you're getting some treatment, hopefully good treatment, but hopefully that reinforces the idea that the more you can understand about pain, it should help you then with your choices and some of the action that you might take to feel better. So generally we feel that, when you understand why things hurt, you hurt less. And knowledge generally, they're not on mute, I'll mute them. And knowledge generally we find is liberating. And I think especially knowledge in these sorts of forums where you can learn about it in a casual, hopefully safe, comfortable way, where you can, learn from us as facilitators, but also each other. So concept 1 is just how important now we realize that having a good understanding of pain is when it comes to helping our patients manage their health. All right, concept 2. Again, some of these might sound like really easy and straightforward, but hopefully there's still some insight that we can gain. Oh, I'll cancel that. Sorry. So pain is normal, it's personal, and it's always real. So I guess this concept, one thing that's come through in some of the conversations I've had with patients over the years is that at times pain can feel very isolating. It can feel like no one believes you, or people question what you're experiencing, and it can be really hard to feel heard and understood. But this is now a major concept that, in the research and the evidence, we're happy to share in that, your pain is real. And I think when it comes to talking about your pain, either to friends, to family, to different health practitioners, this is a really important thing to feel confident in yourself, that your pain is real, It's personal. And I think that hopefully helps you understand why some people's experience is different to your own, and we don't all process the same experience differently. But it's real. Okay, so it is there. And I guess part of our role as health practitioners is to then help you work through it and identify what might be causing it. And so pain, the main job of pain is to be a protector. So the role for pain is to help protect you from what your system perceives to be a dangerous or threatening situation. So, and it's usually, and I bolded that deliberately, it's usually a useful response to help you do something or get out of the way or act in a particular way. And I guess that third point reiterates that, where pain is very, very powerful and convincing in helping you change your behavior. So, Fabio, can you think of any time that pain has gotten you to change your behavior?
Oh, definitely. I'm not exactly a very resistant individual. If I'm getting tummy pain or stuff like that, I'm definitely going to be in a bad humor. So I don't cope well with pain. I'm one of those people that have pain, I have to take medication straight away.
Okay, you don't like it. So it'll make you act and find some medication and deal with it as quickly as possible.
Definitely. Otherwise, I'll get in a very bad mood. If you see me in a bad mood in the clinic, Sarah, ask me because I'll probably be in pain.
Okay, I will. It's like we're learning things about you, Fabio. That's good to know. I'm happy to share something. I think for me, a simple example, I guess during lockdown, I definitely experienced a bit more neck pain than normal. I think poor posture, too much time on the laptop, and how I sit on the couch. I'd be ashamed to show all of you a picture. And so when I start to feel more of it, for the first time probably ever, I actually really used my spiky ball. Like if you've ever seen a physio in the past, they might mention that doing some spiky ball or doing some self-massage helps. But the pain in this instance did actually make me do that, not just the physio telling me to. So I think there's lots of examples. And again, tonight, when we go through these concepts, if you've got any of your own personal experiences, you'd be happy to share them, please pop them in the chat. But I hope we can all agree that, pain's very powerful at helping you do something. It might not always be a helpful thing that you do, but it can typically provoke you to act and change what you're doing. Okay, concept 3. Now, this one's an interesting one. And Fabio, you're going to help me explain this. So this talks about having an examination. So anytime we experience pain, we feel that a thorough examination is helpful for a large number of reasons. And we do so because we think an examination, and we'll go through what a thorough examination may or may not be in a sec, is really to help evaluate your specific situation. So that's why tonight we're not going to be able to solve everyone's particular situation, because it's not going to be specific enough. Tonight's about going through broad concepts, which can hopefully help you learn a little bit more. But a thorough examination is really helpful. And typically we encourage this examination to happen as early as possible. And I guess not in every instance. I guess if you just kick something in your home and you stub your toe, you don't need an examination. You might just say, ow, and get on with the day. But if the pain persists, or if you're unsure and you've done some Googling and you're still not sure, then that's where seeking an examination can be a really important step in understanding what's going on in your own body. And so who can do that? It can be a GP, it can be a rheumatologist, it can be a physiotherapist. It really depends on where you're experiencing your pain and when it's come on. But hopefully you can find a health professional that can start to go through your situation with you. They'll hopefully try and help identify and prioritize the concerns that you have, and then potentially include things like investigations if necessary. So MRIs, X-rays, blood tests, anything else that can help them get to the bottom of the problem is a helpful thing to do. And so, Fabio, I guess if someone asks you, what's a thorough examination? How would you answer that for a rheumatologist?
Well, one of the main difficulties in the day-to-day clinic is that there's something called a referred pain. So the pain is not always on the focus of the damage. I have one example from back when I was in Brazil that's very, very important. I had a young patient, 40-something years old, and she had a chronic knee pain. So she's been to different orthopedics, and each one asked her to do an MRI, which always showed osteoarthritis of the knee. And she was having a lot of knee pain, taking a lot of anti-inflammatories, steroids, painkillers, and nothing was helping her. So she came to me. And on physical examination, I noticed that when I pressed the tendon that's below the knee, she had a lot of pain. So I just treated her with ice packs, and that's it. She was completely better. So I think that's a great example of the importance of the examination, because the pain wasn't exactly in the knee, and why sometimes the investigation may not include an MRI, because the MRI in this case just got in the way of the proper diagnosis. The osteoarthritis wasn't causing her any issues. The problem was the tendinitis.
And how much emphasis do you put on, I guess, the story and even just the conversation you have with your patients? Do you think that's also part of a thorough examination?
Definitely, because it changes if you have pain in just one joint, if you have widespread pain, if you have a lot of pain only in the joints and a lot of joints, or if your pain is also in the muscles. It changes a lot if it's an acute onset of pain, it's intermittent, it's chronic. So everything points to a specific diagnosis. So first thing is a thorough history, a thorough investigation, and then if needed, we proceed with investigations.
Excellent. And I think part of a thorough examination is the ability for all of us, so we've all been patients at different times, seeking help for different things, is feeling safe to ask questions and feeling safe to ask for things to be clarified if you don't quite understand why you are getting investigation or why you might not be. So I think an examination is a partnership, and although you might be seeking the help of a professional, it's good to ask questions. If you're unsure, it's okay to seek that clarification, because that in the long term can do, again, great wonders in helping you move forward and address the issue. Underlying concern and feeling really worried and anxious about things can impact how our pain system works, which we'll talk about a little bit later. But I hope that makes sense. And again, if you've got any questions about examination, then please, again, pop them in the chat. Before the next slide, I hope I've remembered this at the right time. There's another question for the audience. This one's even easier. It's true or false, and it will lead us into concept number 4. So I will launch and give you a couple of seconds. So hopefully you can see that now. So the statement is, the severity of pain that you might experience is always equal to the amount of tissue damage. So see what you think. Still some. Very good. I'll give people like 5 more seconds. Maybe there's some people sitting on the fence. It's okay. We're not going to come after you if you're wrong. All right, because I think this is, again, a big one. But I'll end it and I'll share the results. Pretty good. Well done. So the 90% of you that said false are correct. And again, if you said true, not to worry. It's very challenging. And this is one of the biggest things I think I spend time talking to patients about in our consults or at the clinic. But again, we know that pain and tissue damage don't always relate. They can, but not always. And so that can be a really reassuring thing to hear, because I think when we're kids, or depending on your first few experiences of pain, that message can be really hard to rewire, I guess. So if you think that I'm feeling a lot of pain, that must mean there's a lot of damage there. That's going to get you to change your behavior in quite extreme ways, And so it can be reassuring. Hopefully it is reassuring to understand that it's not always the case. And pain, unfortunately, although it is designed to protect us and we have all these awesome cells and a system in place to help us navigate day-to-day life, pain is not always so reliable about what's going on. And the pain system can definitely malfunction. It can definitely get a bit funky. It can definitely kind of do some tricky things that can make it hard to understand whether there's actual damage or not. Okay, so again, if there's any questions around that, happy to hear them. Again, maybe Errol, have you got any stories or any of your own experiences that relate to this concept in terms of?
Absolutely. All the time. I mean, I'm probably in the same boat as Fabio because I'm male, so I hate pain and I don't cope with it very well. But yeah, definitely. I think over the last 10 years, there's not probably a day I wake up now. I'm for those of you who don't know, I'm 45 now. There's not a day that I wake up and I don't have something that aches. And it takes me about, a good hour before I warm up. And I don't have a rheumatic condition or a chronic problem. It's just things that get sore. But it'd be all the things that many of our patients complain of, right? Pain in the Achilles or pain underneath my heel or shoulder pain or neck pain. And then you feel, oh, maybe I slept funny. Why is my shoulder a little bit sore? And for that split second, I kind of think, oh, what's wrong? What's happened? But then I have to remind myself, nothing happened overnight. I was just sleeping. And yesterday I was okay. I still managed to move. I still managed to do my exercise. I probably need to get going and hopefully things will settle. And 99.99% of the time things settle. It goes away. And even though I'm a physio, I still get that fear. I definitely know pain doesn't relate to damage or damage doesn't relate to pain. But yet I have to fight it each time I feel it. And so hopefully you take something out of that. But I think that's something I have to keep reminding myself.
Yeah.
The opposite is also true, Sarah. Sometimes we sleep, Errol was talking about sleeping funny. Sometimes you sleep funny and you wake with your arm completely numb. So you can take an axe and hit your arm, you're not going to feel any pain. There's obviously tissue damage. So the opposite is also true.
Yes, definitely. And I think you might have read stories or heard things in the news sometimes where there's really extreme cases of this happening. So I remember I did a course about this stuff a long time ago, and one of the presenters told a story. He was, I think, a registrar, and he was doing some stuff in the emergency room, and he saw someone and he had, like, I think it was an axe or something, like, wedged in his leg. So it was clear that there was, like, definite tissue damage, but the guy was calm. He's like, how you going? Oh, I've been waiting a while. He was, like, totally not experiencing pain, but there was clear, visible tissue damage. And so that can be really, when you see it, it can be very jarring, because it's, like Errol said, it's a bit of a fight, because I think, when we experience it, it makes you want to act and do something, even if you can reassure yourself that you're probably okay. So, I agree with Errol. I think I remember my first, like, episode of low back pain, like a strong episode of low back pain. And I guess I knew what it was. I was working at BJC, so I knew I could get help. And I texted one of my physio colleagues, but I still panicked. I was like, I don't think I'm going to be able to work. Am I going to be able to get to work? Can I walk? I normally park my car quite a far away. I didn't know if I was going to be able to walk. So the panic can be real. And that's why I think over time, having the knowledge yourself is great, but then having people around you who can also reassure you and remind you or help point you in the right direction if you are feeling a bit stressed or a bit panicked can also be part of this. So our next slide isn't a key concept, but this might be a term. It's a big word, warning, but Fabio definitely thought we should talk about this. And I guess it relates to one of the ways the pain system can malfunction. And I thought it might be something that some of you have been told relates to your situation, or you've read about it in trying to get knowledge about pain. And it's called central sensitization. And I know Fabio practiced saying that earlier today a few times. So it's a long, tricky thing to say. But Fabio, what's your take on central sensitization and what does that mean?
So basically, to summarize, when you're But basically, when you hit your arm or something like that, it's not your arm that defines if this is pain or not. It's your brain. So you got to get the message up to your brain. So the brain interprets and sees if it is or isn't. But could you imagine how hard it would be if everything we went through had to go through the brain? Every hair moving through your arm, every wind that stroked you, it had to go to your brain. So the nerves have a filtering device, and this filtering device can malfunction. So everything you're going to feel like it's pain. And sometimes the filtering device works the other way around. It amplifies everything. So even something that you shouldn't be feeling pain, you start feeling pain. We have technical terms for this called allodynia. So it's known for a while, and only recently we found out what that means, which is the central sensitization, which I managed to say that successfully, hopefully.
Not successfully. Very good.
This is one clear reason and incredibly common reason why you're going to have pain and no tissue damage.
Yep. I agree. And hopefully what's on the slide there, if you've had the chance to read it, also helps. So sensitization typically takes time to develop. It's not something that just happens overnight. It often will take weeks to months to present. And it's just because, again, pain can actually modify how your nervous system works. And so your nervous system includes your brain, the spinal cord. And so that over time, like Fabio mentioned, it's possible that then things which never used to cause you difficulty now are painful. So it's possible to experience even more pain from things that, you know, maybe a few months ago didn't cause you any issue at all. So that's where it can get really tricky, and it can get really frustrating to understand what's going on when things keep changing. But we know this is definitely a phenomena, and something that, again, as part of that thorough examination, a good health professional will help identify whether this might be something that you're experiencing. And the following quote, I thought, again, was a patient experience. It's hard to tell what's going on and what's going to make you feel better or worse. You might have good days, bad days, and it can be hard to figure out why. And that's where we say central, because it's to do with the central nervous system, which is your brain and spinal cord. So this can be tricky. Again, some of the things we speak about tonight can help with central sensitization, but we did think it was worth just mentioning. And if there's more questions about that, we're of course happy to take them. Okay, last question in the poll before we go into concept number 5. And Fabio kind of gave it away. So if you're listening to Fabio, you should be sweet with the answer.
I know that was this question.
Oh, I know, Fabio. Okay, final question as part of the poll, and then everyone can relax. There's no more questions after this that you need to answer. But pain is produced by, is it your spinal cord? Is it your injured body part? Is it your brain? Is it nerve endings? I was going to do an all of the above, but I thought that was going a bit overboard. I'll give you a few more seconds. Got a few more people to go. Good. Again, don't worry if you want to have a stab. This is interesting. Okay, I'll end it and I'll share the results. Very, very good. You guys, everyone's starting to knows a lot about pain. Excellent. And Fabio, hopefully that means they were listening to you as well.
Well, there you have it. I hope you enjoyed part 1 of our Pain Points free educational event. If you'd like to continue watching the presentation, then please consider signing up for BJC Connect. It's free, and you can watch part 2 as well as a whole heap of other educational events the team and myself have recorded. So I hope you enjoyed that. Hope you learned something and you feel a little bit more empowered to help yourself manage pain and feel that little bit better.